So good morning. I wanted to start talking a little bit about the products that I sell, and because a lot of people don't even know that these products are available. And so one of the things I want to talk about today is it's UNL, it's United National Life. I think this is probably going to show up backwards, but it's United National Life, and this one is Home Health Care Shield. It's a short-term health care insurance. And so when you open this up, it talks about it seniors, because my main insurance that I work with is 65 and above, so seniors. But you can get this product. You do not have to be a senior to get this product. And so it basically says that Medicare, so for, if you're 65 and above, it only covers up to 21 days and fewer than 8 hours a day and fewer than 7 days a week for a home health care. Some exceptions in special circumstances. Almost 70% of people turning 65 will need long-term care at some point in their lives. And it says the median cost for home health care is about $50,000 a year. That's scary. So it says that, so why Home Health Care Shield from United National Life? Because like most Americans would, if you have something happen, you would rather recuperate at home and not in a facility. Benefits are paid directly to you, regardless of what insurance you have. So this policy is an indemnity policy. So what that means is that if you have an event that triggers this policy, you will get money put directly into your bank account. It doesn't go to the facility. Nobody tells you what to do with the money or how to spend the money. You decide what you do with this money. So the money is paid directly to you, regardless of any other insurances that you have, health or otherwise. You can combine this short-term home health care benefit with coverage for hospital stays and accidents to enhance your coverage. You can collect short-term home health care benefits. A prior hospitalization stay is not required, so you don't have to go into a hospital to trigger this policy. Benefits can help your health insurance cover deductibles and also co-payments. So you decide what you want to do with the money that you get from this policy. So the base of the policy contains 4 separate parts, okay? So part 1, it says UNL will pay a daily benefit for each day you receive the following home health care services. Daily benefit amounts will vary depending on which plan you select, and there's 3 choices. And the benefit period, the maximum benefit period is 360 days. That's why it's a short term. If you go into long term, that gets a lot more expensive and it's just a different deal. But this it will go up to 360 days a year. And to qualify for the benefits, a licensed healthcare practitioner must certify you as having either a cognitive impairment or an inability to perform at least 2 of the 6 daily activities of daily living without substantial assistance. So in other words, if you need help taking a bath, using the restroom, dressing yourself, eating, continence, transferring, meaning getting out of the bed to your chair or anything like that, like if you had something happen and you have an injury and you can't care for yourself, then you can trigger this policy. So you have Plan A, Plan B, and Plan C, and daily benefit amounts. So if you get Plan C, which is the best plan you can get paid up to $450 a day into your bank account. And if you're injured and you need to recover at home, you're not going to have income. And so this is a really great policy. So if you need skilled nursing care, general nursing care, so either an RN, LVN, LPN, physical therapy, speech pathology, occupational therapy, chemotherapy specialist, interstomal therapy, respirational therapy, or medical social services, then the benefits payable to the home health care to you from this policy you get a combined benefit of either 150, 300, or 450, depending on which plan. So plan A, B, or C. And then if you have to like have a physical therapy, you get paid 200, and say you need another one, you get paid. So plan C is 200 per each one of these that are listed, except for the medical social services. And then that's $300 a day that you would get put into your account. So then it says part 2, short-term home health care aid benefits. Plan A is 40 per day, plan B is 80 per day, and plan C is 120 per day. UNL will pay a daily benefit for each day you require the services of a home health care aid. Daily benefit amounts vary by, according to the plan that you select, and the benefits are payable should you have an inability to perform 2 or more of the daily activities of daily living, or you have a cognitive impairment. A prior hospitalization stay is not required, and the maximum benefit period for the home health aid is 60 days. It does also have a prescription drug benefit. So it says UNL will pay a benefit of $10 for each generic or $25 for each brand name prescription, up to a policy year maximum of $300 for plan A and $600 for plan B or C. So you can get that. And then part 4 is restoration of benefits. Benefits are restored if benefits restore if covered home health services have not been rendered for 180 consecutive days, and a licensed healthcare practitioner has certified that you have sufficiently recovered to no longer require home health care or nursing care services. So it doesn't go away because you trigger the benefit. It doesn't go away. It'll reset, and then you can trigger your benefits again if you need to in the future. And then some additional benefits that you can add to this policy is you can combine your short-term home health, which is this plan right here, and you can add an accident and sickness hospitalization rider. So that's an option you can add. You don't have to. But it says with the UNL accident and sickness hospitalization rider, you will receive benefits of up to $300 a day, dependent on the plan that you select. And should you become confined to a hospital due to an accident or sickness, you can choose a 3-day or 6-day benefit period, which will restore after 60 days of no hospital confinement. Further benefits are paid for hospital stays as long as confinement was at least 24 hours. So that's a really, really awesome little benefit you can add. And then there's a critical accident rider that you can add. So after an emergency room visit, this rider will pay a lump sum benefit for the following types of accidents or injuries. So if you have this critical accident rider and you add it to this plan, if you die of an accidental death, depending on which plan, you could have either a $5,000 death benefit, accidental death benefit, or $10,000 accidental death benefit. If you fall and you break your hip or have a skull fracture, you could get $1,250 or $2,500. Hip dislocation, knee dislocation or knee ligament tear, and also any other fractures. There's a benefit for that as well. Then you can also get what's called a return of premium death benefit rider. So this rider provides a return of premium benefit in the event of your death prior to the attained age of 86. So if you die before 86, you get all the premiums you've paid. This rider provides a return of premium benefit in the event of your death prior to attained age 86. So, and then it has 2 more riders that you have the option of adding to this plan. One is an ambulance rider, and everything that you get paid goes directly to you. No facility gets the money from this plan. So an ambulance benefit rider, this rider will pay $200 benefit for ground ambulance services to and from a medical facility up to 4 times a year, and is subject to a lifetime maximum of $2,500. No hospital confinement is required. And then the last one is a dental vision rider that you can add to this policy, and it will pay you an annual benefit of $400 and $2,000 for services performed by a licensed dentist ophthalmologist or an optometrist after the first year, so it has to be in place for a year, and then that benefit will trigger, including $200 for prescription eyeglasses or contact lenses. And then also part of this, the last thing, is the access to the Mayo Clinic. You have access to answers that are time-saving, cost-saving, and potentially life-saving right at your fingertips. You select a symptom, you answer symptom-specific questions, and then you receive care guidance. And so then you also have access to this 24/7. So that's just a little bit about this United National Life Home Health Care Shield short-term home health care insurance. And I just wanted to talk to you guys about that. I have a lot of other different policies that I'm going to try to showcase on here periodically, because a lot of people don't even know that this exists. So if you're interested in learning more about this, please feel free to comment below, and I will be glad to get in touch with you. Okay? I hope y'all have a wonderful day, and I'll see you later. Thanks. Bye.